Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Roger. I'm your host for today. Today we have with us Dr. Nestor Praderio. He was born and raised in Argentina. He's a graduate of the University of La Plata School of Medicine and completed his residence in psychiatry at the Yale University affiliated program of Connecticut Valley Hospital in Middleton, Connecticut. His special interest is focused on geriatric psychiatry. He is a consultant of many nursing centers and assisted living units in South Texas. He is also the founder and president of Face to Face, which is a nonprofit organization and Alzheimer's support group. All of his time dedicated to this organization is volunteered, and it includes monthly meetings in which he speaks to families, caregivers, and clinicians, the annual Face to Face Festival, and a yearly Coastal Bend Walk for Memory. Welcome, Dr. Praderio.
Thank you very much, and I am glad to be here. Like I said before, I wish you a good year, and I hope with this year we will be able to mobilize a little better and work ahead with what we know how to do so well, and is taking care of others. It's very difficult when they ask me what I would like to chat on the February teleconnections. We struggled for a while, and I talked to my friends, and I talked to Elsa and other members of the group, trying to find out what will be an issue that we can explore together and find out what happened during this difficult time. And we decided, how about we chat a little about what occurs during the pandemic time, how we survive struggling and working with the individual that we care for, and specifically how we feel personally. And interestingly, there are not too many informations about feeling per se. There are many about symptoms and what happened and how anxious and depressed you become as a caregiver. But in general, there is not an extensive exploration about what was going on in your mind with all of this. For example, this characteristic return to normal has been switched for something that makes more sense, and is to return to a new normal. To return to a new normal that we honestly don't know with certainty. We don't know if it's similar to the one that we left behind, or change will occur to the point that they are going to be creating more problems and difficulties for us. There are floating feelings of disconnect always around us. In general, I believe this has been provoked by the lack of socialization that we has been going on for almost 2 years or 2 years. Therefore, we are unsure to where is the real truth and where are we standing to focalize in what is going to be the future. And this is a subject that occur in any level of caregiving. For family members, when you care for family members, when you care professionally, and include all of this situation that you go through. And we can start pointing, and I want this today, we have something very participatory and mobile, because I want to hear how you feel about this. But we can create an initial charge in talking a little about what has been negative aspect of all of this. Specifically, what we sense this left mark, this we will need to work to correct it, the left some wound that you will need, that we will need to work to heal it. But one of the most important one is the impact that what happened left on us. And the impact is being read differently by different individuals. The majority of the individual, through the isolation, end up with remarkable symptoms of sadness and depression, with some feeling of emptiness. This appear to get exacerbated by the lack of knowledge in what direction will go, and not knowing with certainty what is going to happen tomorrow. We are just locked up in and the only thing that we have positive is this: if we are in here, is probably secure, but nothing more than secure, because we are not in contact with others. And really, it's kind of devastating, be day after day knowing that your socialization skill, the outlet that we use in life to verbalize some of our feelings, goods or bad, is being just disconnected, and we lost contact with a reality that we will need to have to be more in contact with. And that's the form this thing occur at the level of becoming depressed. You start questioning, honestly, how this happened to you. The, regardless the circumstance, you are a strong individual. You never expect the thing will happen in such a way that you are partially scared that what this is going to provoke in the person that you are caring. You are concerned how this is going to impact in your family at large. Therefore, there are many issues that the isolation create in coming down with a sense of depression. It's almost impossible to differentiate those who has been suffering depression and having anxiety. Both of them are coming in a package. Both of them come hands on hands. And specifically, the most anxious is the behavior. The higher the probability that you will end up with some depression, with some difficulties, some disturbance that later on you will have to need some help to correct it. The anxiety is a little different than the feelings of regular anxiety. The anxiety is fluctuating. There are moments of the day this is more present than other moments. The other times is a little suffocating. And when I say suffocating, is with a little of a flavor of a panic disorder. In general, you need to sit down and relax for a while, because if no, exacerbate to a point that then create problems for you. Many individuals in research we notice are having an insomnia. during these times. And the insomnia is associated with a high number of stressful situations and how we move with this. Well, let's start. Just each one of you can please personalize and prepare your sharing feelings, because we can work all together with those feelings. You just let us know and let Glenda know, and you can unmute yourself and share with us, and we process together through this difficult time. Let me start with me. I don't want to cheat. You have to do all of the work and I don't. I have been doing my work for 30 years. I am a caregiver for 30 years. For the last 25, since I am in Corpus, I dedicate strongly my caregiving toward geriatric. Therefore, my life, honestly, is very simple. Or I see geriatric patients on the hospital and inpatient, or I walk 72 nursing homes in South Texas, or I see patients in my office, geriatric patient in need of support and follow-up, beside other activities. Well, when the pandemic was declared, I received an order that I won't be able to see my patients at the nursing home. We were just locked outside of the nursing home for a period of 6 to 7 months without entering in continuing with the habit of saying hi to your patients and dealing with what was going on. At the same time, we set up in my office, minimizing the circulation of people. We set up a waiting room with the distancing that was appropriate, with the check-in, with the temperature to here, to there. And my practice from being 100% face-to-face mobilized to about 30% face-to-face, 70% went into telepsychiatry. And the hospital continued being hospital with all of the provocation of fear and distress, because I was seeing patients in places in which the risk of contagious was very high. With these three components in mind, let me share with you my feelings. At the beginning was impacting because I didn't know exactly the consequence. I didn't know exactly in what direction we were going and what will be the outcome. I start moving ahead with feeling of fears and precaution, but a fear that was more an invitation of not wanting to do this anymore, almost a fear and sensing escape, like, well, if I have to cancel, I will cancel. If we have to postpone 1 week, we will postpone. And honestly, didn't fit with me. This is nothing to do with what I did for years. Therefore, I mobilized, I tried to continue doing more and more, and I found situations that were really sad. And I started practicing and wanting to see people in nursing home again, and were struggles of any aspect. A lot of sadness with the family members and caregiver of the individuals on the nursing home. And an impacting issue is people don't talk, is the sense that every day we were looking around and we will find more people that got so sick they end up dying. And honestly, I lost 3 colleagues, doctors in Corpus Christi, in a matter of a month and a half, and was very traumatic for all of us. Very young people with no much comorbidity, and create the sense of insecurity that we were walking around constantly. And this is something that we need to continue working in order to release and not allowing this pathology to push us into having a post-traumatic stress disorder or something in relationship. Well, let's go. Who is going to unmute and tell me about feelings during this time? Who's
And
that?
yeah, y'all go ahead. If you unmute your phone, I can call on you. I can see it on my computer screen. If you call, if you called in your telephone, press *6, and that will unmute your phone. Who wants to talk about how they're feeling? I know you have feelings out there. All I see on my screen is IDH. Please go ahead.
Okay, it's actually L. I should have typed in Lisa. So hello, everybody.
Hello.
Hi. I just wanted to tune in. This is the first time I view one of your teleconnects, and I'm really enjoying it so far. But I do have feelings I'd like to share. I feel very frustrated when a certain topic comes up, and it happens around. I'm with my mother. And she's still able to get up and do everything for herself, but she checks the mail like that is her source of livelihood, and she thinks everything is so real in that mail, and that for some reason that's my most frustrating moment that I can't deal with, or I have a problem dealing with. I don't know how to address it calmly or without turning my cheeks red when she starts asking about financial stuff, because that she does not grasp.
Yeah, well, Linda, you're touching a point. This is very common. Number one, don't feel like your mother is the only one and you are the target person. It's very common, and as a symptoms of a dementia syndrome in general, there are distortion, lack of judgment, and poor rational, and the thinking of individual with the disorder. And what you are pinpointing is a false belief, and there is an over-elaboration around those issues that sometimes become a little delusional. If you pay attention, Linda, is one of the benefits that people creating abuse and neglect utilize with this type of patients is making them to think these are partially believable or no. Therefore, any material that they take in their hand, they collect it, they read it, they overread it, she will argue with you. And one of the best intervention is to start using at this point in her state of mind, the decreased exposure. Decreased exposure is find a way that you minimize the mail that reach her hands, and you will have a little more peaceful integration and communication with her. How to do it is, well, you use creativity. I don't know if the mail came directly to her hand, to the mailbox.
Yes.
Therefore, you can be attentive. You can even have a conversation with the mailman and and find a way in which one maybe some material can be removed. And I don't know if you are handling the finances of her, of if she
Yes,
continue. You are doing right?
with her. Yes.
Yeah, with her. Yeah, and I think we will have to be patient with the intervention because it's difficult. They become agitated, they become very argumentative, and our frustration increase, and then you feel like it's something that you are not doing appropriately. But I appreciate your question. It's a very common one. And thank you for attending today. Stay with us, please. We are together every month and will be important to hear.
Thank you.
Thank you so much. Anyone else want to tell us how you're feeling and how you've been affected by the pandemic?
No, Philip.
Marilyn, please go ahead.
Yes, this is Marilyn Whitaker, and I just wanted to say that sometimes I feel frustrated and agitated myself because I'm caring for my mother, and I've cared for her for 7 years, and she's so resistant of what I'm doing, even preparing the food, and I just feel like I'm failing all the time because she's never happy about it or never content with what I'm doing, and I am her full-time caregiver. So, I mean, from what I'm hearing, I guess that's pretty normal, but that's just how I'm feeling all the time, and I don't want to get into a rut of it, but just wanted some information on is that normal? What should I do?
Marilyn, thank you for participating. Thank you. What you express is something that's occurred to all of us. I think there are times we slow down and start thinking, look at what is the payoff after I spend my day helping you and to hear what I have to hear. Remember, Marilyn, that we are dealing with individuals that slowly are losing reasoning, judgment, and way to communicate. They have executive function disorders on the brain. Therefore, everything that you learn through life about comfort, education, ethic, and then the way that you manage with others disappear. We can say that they lost the complete braking mechanism and they just talk freely like there is a 2 or 3 years old child telling you think that they don't control, don't filter, don't accommodate it at all. And that's happened very frequently. And it's a factor, this is always creating problem with caregiver because you feel super frustrated. And in addition to this, you sense that there is no recognition for what you are doing and that everything is criticism. Well, Marilyn, this occurs specifically on the moderate stage of the illness. When they start persistent with being able to talk, but the talk is so negative and is so rude in content. Therefore, I think the time has to pass with a little more distraction. This is a time that you start learning, number one, your role is to obtain a good outcome from your job. This is as a caregiver. And missing a little, letting go, that's both of acceptance that you are expecting because it's not going to come. And when I say distraction is to say, well, mom, why we don't do the following? On the middle of her negativism, you say, why we don't do the following? Let's go and have a cup of coffee. Why you don't eat something? I prepare a drink for you. Do you want to eat an apple? And all of those mechanisms that we talk so much in distracting individual, little by little start working instead of even attempt to argue situation at this stage, because we'll exacerbate it. And every time that you exacerbate a thought, is going to be replanted, and you have a high risk. This may be including a psychotic implantation of a thought that later on will be worse for you because she will mark you in association with those things. Therefore, I think with distractions and kind of be sure that you protect yourself without personalizing so much her comment. This will be the way to move. Thank you, Marilyn.
Thank you so much.
Thank you,
Thank
Marilyn.
you.
Yeah.
We had a question come in on the chat box, Dr. Praderio, and it says, being a 30-year caregiver, can you give us strategies for dealing with negative feelings that occur as the months and years of caregiving go on? Talking about resilience, I believe.
Well, I can believe this in our profession. We will have similar sentiments if we go with such a long period of time caring for others. There is times in which there is a sense of injustice because people are not able to comprehend what we are doing for them. There are times in which we personally don't know how to deal with the feeling of frustrations and feeling anxious and feeling depressed. The initial part of my answer will be this: I would like that this person who shared this with us is sure that she is not suffering the caregiver burning component, in which years after years continue with the same dynamic, and suddenly you start sensing this, you don't know what to do with the accumulation of feelings, and this are coming to the top of you, and you know how to end or how to deal with. And therefore, important is to know that she is not depressed or she is very anxious for a long time without receiving an appropriate support and help. Second is she will need to redefine what is her role, because many times we jump as a caregiver and we get this job, nobody publicize in total what is the role of the caregiver. There is not a college course, there is not a book that specifically give you an insight in such a role. Therefore, we go with a loose mind, and many times we go with a sense that we love the individual and we are going to do the best to care for. Sometimes we go because there is no other solution. I have daughter or son that are involved in caregiver, and they has been 25 years not talking with mother or father, and suddenly they become a caregiver. It's very difficult to mix a chicken with a duck and put it together and say this is going to be a very nice functional animal. No, but won't work that way. Won't work. Therefore, we need to recognize from the beginning of the process what is the goal. And for many, through the years of my working, for many of them, caregiving has been the approximation, the recognition, the rebuilding of a relationship, and the preparation for a more healthy termination with individuals that are family members. But we need to be careful. There are times in which you end up with frustration and disappointment because the one who is your mother or your father or your aunt changed behavior due to the disease, and it's something that you were not expecting, and we need to be careful with that. But honestly, it will be nice for her to do a kind of refreshing of her profession and status, and to take a little retreat and to get together with good friends and trying to chat a little about this, and to have a good book and reading a book, taking some time off. And if for any reason it feels depressed or anxious, please, it's very important to reach out for appropriate mental health service.
Thank you, Dr. Praderio.
Okay.
Anyone else wanting to share what's going on, how they're feeling?
No feeling.
And you know that's not true.
Yeah.
Well, I can say one thing about me, since you talked to us about what had happened to you. I'm not a caregiver at the present time, but have been in the past. But as you said, not really you. Sometimes I don't really feel me when I go out in public, because I have this sense of apprehension about what's happening out there right now. And we've been so reclusive over the past couple of years. How do you kind of deal with that apprehension that you feel when you're around people again?
Well, Glenda, it's exactly what we say at the beginning. What you're expressing is kind of a feeling of disconnect that we use very much later on in trying to review what is the outcome post-pandemic. And it's a feeling of disconnect. And the feeling of disconnect is provoked for our sense of lack of socialization, because we didn't create this. We don't become antisocial. No, we protect ourselves and we stay inside. We lost the continuum of friendship, the contact, the routine, the habit, and we transform. And that lack of socialization create this disconnect. Therefore, Glenda, the answer is as soon as we can move with a sense of better safety, as soon as we can start re-engaging slowly in some previous activities, as soon as you can join and reach out for your friends or family members, and it's going to start helping you. And at the meantime, do something that will slowly transport you to the social level. And it's a Saturday, it's a Sunday, it's a sunny day. Take the car and go for a ride. And go for a ride and stop in places that are not many people, and take pictures, look at the water, do something just exiting the house. And slowly you will start regaining the sense of introduction back to the previous time. It's like I said at the beginning, I prefer to name it a new normal, because honestly, I don't have any idea what's going to be. But that is a point. And many people feel on the same way, Glenn. Reviewing papers on the last year and some of the research, the feeling of disconnection is a very, very clear one. Very clear one. I can re-socialize.
Thank you, Dr. Praderio.
Thank you, Glenn.
You can always enter your question or comment in the chat box if you prefer not to speak out. And as you can see, I'll definitely read that to Dr. Praderio, and he will address your concerns and how you're feeling.
Can I touch, this is Lisa again. Can I touch on a response that the doctor was talking to the person that was after me. It was talking about negativity, about how you handle a particular situation so that you don't become
Yes,
a negative mark in, like, in
yes.
my
Go
case and
ahead.
another's mind. Okay. I just was curious if there was I wanted to make sure I understood. I wanted to, when something comes up that's very negative, which is a lot, and like I said, in my case, directly towards finances, but did you suggest that we just listen and not make a issue? I mean, I just wanted to make sure I followed that path, because I'm not sure I quite grasp
Yeah,
like what.
Lisa, I explained this to Marilyn before. Distracting is the name of the intervention, and how you exit the conversation without argument and without confrontation. And you decide to pick a point of distraction, and do say, Mom, why we don't talk this later on? Mom, why we don't have a cup of coffee? Do you want me bringing some iced tea? Let's go and sit outside for a little while, trying to move away from the situation that you has been involved at that time. And that's worked very well, because in general, the recollection and the memory encoding of your mother is very short. In about 3 or 4 minutes, she will be disconnected from the subject and the discussion that you have before, and you maybe later on can approach her differently. That mechanism occurs with refusing medication. You go with the medication and they say no, and we start, why you don't put it here? Do you want me put it in applesauce? Do you want me doing this? Mom, why you don't eat them with chocolate pudding? Here, open your mouth. This is chaos. You come with a medication, you say, Mom, it's your medication, we will take it together. I brought some ice cream. This is delicious, blah. And she said, no, you just finish. That's it. You don't pursue anymore, and you return 10 minutes later, and she eat the ice cream, take the medication, and the both of you are happy. Those are mechanisms of distraction, because you cannot continue with the same subject. They are unable to rationalize and to use any judgment to disconnect from that.
Thank you.
I wanted to comment again. This is Marilyn. That is exactly what I'm starting now, because you've heard the term pick your battles. So instead of trying to rationalize with her, or try to get her to see it my way, I've tried physically walking away, coming back, like you said, 3 minutes later, and just changing the words, and then it gets done. Now, mind you, that can take a while, but it does work. Just kind of walking away or just changing the subject. But when I was just sitting there trying to convince her, let's take your medicine, I mean, it just escalated, and it just got more and more. And then, I was in another meeting, and I heard the words, pick your battles. And I thought, okay, so I don't even dwell on it. If she's not wanting to take the medicine, I just bought a peel crusher, and I've started crushing it up, just putting it in the applesauce. And she loves applesauce, so she'll eat the applesauce. So I eliminated that. But when she starts to, I'm not gonna do this, I'm not gonna, I just walk away. I don't even use any words. I just walk away, walk out of the room, get me some tea, like you said, and sit down. We're having tea. You want a cup? And just kind of change it up.
Yeah.
And that really does work. It takes a lot of time, but it will work.
Good work, Marilyn. That's the way to move. Well, let's go and walk. We have a few more minutes, I guess, Glenda, before we go. Then we can do another 5 minutes of open for questions. But let me just walk with all of you a little through what we have on top of the table after this conversation and after this pandemic, this is not over yet. And what are the things that impact the most all of us? Number one, this situation creates a disorder in which one individual has been moved all over. I lost my patients because they were in a nursing home and the family member took them with them to North Texas or to other states. I lost a significant number of my patients because they got COVID and they died. Patients were removed without us not having any say or decision making from for service, and they went to different places. Therefore, a patient with COVID went to the emergency room from the nursing home, and the emergency room at the time of discharge, the nursing home didn't accept the patient. Therefore, 2 months later, the daughter called to thank me for everything I did for years with the mother. Then now both of them were living in North Texas. She took the mother there because they didn't find another nursing home. Therefore, there was a very disorganized, transient movement of patients, including those that we lost by death. And this is a factor of termination because each one of caregivers and our functions and what you do, professionals or family members, develop a relationship through the time. And the relationship can be acceptable, poor, good. But honestly, we have been traumatized in all of this time by pieces and chunks of our relationship has been just pulled away without any process. Without having the opportunity to say to a family member, just give me a call once in a while because our interaction was healthy for her, was very healthy for me as a provider, and I will continue carrying those like a little medals in my life. But no, this situation is totally different. This situation is more than 50% of my patients, I don't know where they are nowadays. Therefore, there is open wounds, there is lack of time in which one you can dialogue with the family. And the most specific one, there is a lack of connection to help them to proceed with a healthy termination. There were acute form of patient to depart, and that is called death. And it's very difficult to face those situations and to say I was prepared for. Therefore, the death occurred, and then you have to prepare yourself post-mortem, and it's different. We didn't have the opportunity, not even on the monthly support group, to work with these issues. Therefore, I want to bring this because I want you solo, for each one of you and who you are, to have the possibility to restructure your thinking through this process and to congratulate yourself for what you did. And then be able to filter the things that you learn and the things that didn't help you in life. But it's important, very important, that you reach a point of understanding this. This has been traumatic, but we cannot leave it open. We cannot leave it disconnected. There's in one or another way you have to process the termination of any one of your caregiver role. Call your sister, call your brother, get with friends, talk about what happened, revive the situation that your father went to the ER and then you never were able to see it again. Give life to what this pandemic has been taken away from us. Just give it up. Put a sense this our loss has been impacting for the characteristic of this disease, not for the failure of us not being on the right time, the right day. We should not be carrying amount of guilt because we cannot see dad or mom for 3 days because the hospital don't allow me to enter, because the nursing home don't allow me to enter. I have family member coming crying to me and we process for a while because they visit the mother 3 times in a window. They can see it through the window. But when you visit through a window in general, you talk more about what you like, what food you want, than the love and sentiment that you have for them. And you don't engage because it's not common to say, well, maybe this is the last time that I am going to see my mom. I want all of you sharing this with others because honestly, there are many, many caregivers out there struggling with this issue. There are some caregivers out there that they believe that the individual get the virus because there were mistakes that they were making. There were individuals that really conceive in their mind almost psychotic process because the person that they were caring got COVID because they took it few times to McDonald's. And I say, when was the last time that you went to McDonald's? Well, it was approximately a month before she got sick. And I say, why you connect McDonald's with the sickness? That is not connectable. You don't go 1 month having the COVID. And therefore, there is a sense of culpability. The distortion of the role has been changed. And we, the one that we are in charge to teach, to support, to accompany people, we need to understand it because we need to share with others. We need to share with others. This is a form, the role will change. Our normal is going to be a new normal. And the role that all of you are doing is going to be a new normal for those who run group, who do support, who are helping people and family. Think we are coming into something that is new. There is a need of an overwhelming empathy in order to be able to capture the reality of what is today's situation. And I really love your interest and I love your input into this. And I think this we have to reach for more people and to tell them these things are going to be okay, but there are some change on the rules and we will have to approximate to people and take into consideration some of the things that we're discussing here today. I think that this is to continue for a long conversation. And for all of you who are hands-on, already working for the WellMed SOS caregiver group, for any others involved in support group and helping individuals with all of these issues. Maybe it's time for all of that, and I include myself because I see patients all day long. Maybe it's time for us to sit and to think in what way or approach to community care. to long-term care and to how we sit with family member has been shifting a little around, and where we have to give more value and where we have to insert some new methodology. With this, Glenn, we can have a few minutes for open questions. And one more time, I appreciate you shocked me with the number of individuals coming to listening today. I am very thankful, and I hope every time that you see this connection, that you just get there, sign in, and we will talk. Thank you, Glenda.
We did have a question from Mary, and I think this is one that a lot of people will, it will resonate with them. Sometimes our frustration level is so intense that we raise our voice with our loved one and then immediately feel overwhelming sense of guilt and shame. Do you have a suggestion on how we can manage that type of situation better?
Glenn, that does occur very often. Remember, didn't occur to you when you have a kid? I remember my mom just losing her control with me and then coming 3 hours later to hug me and say how much she loved me. But anyway, it's very characteristic of a situation of dementia. It's very easy for us under stress with certain degree of anxiety, with uncertainty, because caregiver of being the caregiver of an Alzheimer patient is a package of uncertainty. Therefore, when that occurs, just slow down a few seconds before the explosive comment. Just do it. Just regulate yourself. Just leave some marker behind. Think a little what happened in the caring of your mother. When in general those sentiments occur, is at the time the mom doesn't want to take a shower? Is at the time the mom doesn't want to get in bed during the night? It's at the time that we are eating and she is almost provocative with what she said. And in one of those areas, or all of those areas, you leave a marker. You leave a marker. It's interesting, but you can create your own markers. You can create a little cube. You can create, I will use, look at this costs 10 cents for each one of these little rubber brain, very small. Look at this. If you leave one on the kitchen and one on the bedroom, every time that you go inside there, you will see it and you will laugh to yourself and you will see, this Dr. Frank, I don't know where he came, told me this, and it's incredible how I am prepared not to jump. How I am just prepared. I am not saying this, I just ignore it. It's impossible to ignore, but I am prepared not to jump. And if I don't jump, the situation is over. Because I will distract, because I will do all of the mechanic that they told me how to do. But the jump, because the jump preserved me to having to feel guilty 10 minutes later. And that is something that may practice those and think this may well work.
A little brain, whoever thought, Dr.
Oh, Glenda, can be different thing. Some of my patients came one day and she have little golf balls, all painted. They look beautiful, and she says she have one on the bedroom, she have one on the bathroom, and she says she will have to put 2 or 3 on the bathroom because it's such a struggle, she lose control. She lose control.
Yeah, a good idea. Chuck, I see that you've opened your mic.
Yeah, thank you. Thanks for all the shares. I just would like to add to that, something that I do sometimes when I feel the frustration level increasing. Basically, what we want to do is we want to de-escalate. And so, oh, excuse me, I have to go to the bathroom. And that takes me away from the situation, and I can take my phone and call somebody or text somebody and process it somewhere else, and then come back and, make a rational, sane decision on what to say or not say, or, and by that time, depending, the other person may not even remember.
Excellent, Chuck. Excellent intervention, because you treat the both end. You run away from the hot issue and you treat yourself too. You regain some space to feel better and to come back to the situation. And the majority of the time when you come back, Chuck, the person is probably on something else. The one who refused the medication will take it. The one that didn't want to take off the clothes for the shower will take it. And as we prevent the impacting connotation, and this is the most important part.
Thank you for sharing that, Chuck. Appreciate it. And for Lisa and Marilyn, everybody else that shared questions, concerns, and how they're feeling. We have about 2 minutes left, and we probably have, time for one more conversation. If you'd like to join Dr. Praderio, you can just unmute your phone and I'll call on you.
Any question is a good question.
For sure. Well, okay, let me real quickly look at my calendar and see what's coming up. If you haven't gotten the February calendar for the Caregiver Teleconnection, it's just jam-packed. So Thursday at 10 o'clock, Lucy Barrelackle will be back with us, and she's going to be talking about safe medications. This is an ongoing series that Dear Lucy does, and so I hope you'll join her on Thursday at 10 Thursday the 10th at 10 o'clock Central Time. That wasn't easy for me to say. Dr. Praderio, any closing comments, encouraging words?
Well, the closing comment is that this is a year that we will have to get together from the beginning and start preparing how we are going to work in our roles of caregivers. I am personally prepared, and I frequently talk to Caregiver SOS with WellMed Charitable Foundation, and I am prepared this we can start doing things on the community and alerting and reaching a point is we push the level of this devastating Alzheimer's disease to a recognizable level, not just the silence and the denial that the society as well as the government have for the disease. I think we need to be prepared to have a busy year. What I recommend for each one of you is to take care, be sure that in your role and in your work, you may feel a little burn, pay attention to those feelings, and I hope that the cold weather start going away and we are going to have good time and good sun again. Happy New Year to all of you, and thank you for coming. Glenda, excellent work.
Thank you, Dr. Praderio, and thanks for all you've shared. People are expressing their appreciation for what you've shared today. And remember, everybody, you're not alone in this. That's what Melody had just said. It helps her knowing that others are dealing with the same feelings as she is. So thank you so much for joining us today. Join us on future Caregiver Teleconnection, and I look forward to it. Bye-bye, Dr. Praderio, and bye-bye, everyone. Stay safe.
Thank you.
Bye-bye.
Thank you.